Welcome to the Medical Minute podcast. I'm Anne Connell, a Melbourne-based GP.
And I'm Moz Calafella, also a Melbourne-based GP.
This is an unscheduled special edition of the Medical Minute podcast, which we've decided to do because of the measles outbreak in Melbourne.
Indeed. We're getting lots of chat on in person, on social media, via email. There's lots of questions, and we thought we'd sort of create a single resource to try and answer the most commonly asked questions as quickly as we could.
Yep. So what we know is that there are 2 cases of measles in Melbourne that have been contracted locally. The people involved have not been overseas, and slightly worryingly, we don't know where they got it from. We don't know what the index case is.
Which is a little bit of a problem, isn't it, Anne? Because it's quite different to the previous measles outbreaks that we've talked about.
Yep, because they've all travelled overseas to a country where there's been measles outbreak, and we think, cool, that's where they got it. But we have 2 cases here that they've got it off some other human being in Melbourne, and we don't know who that other human being is. So these may be the first 2 of many cases, and that is why we're quite concerned.
It's stupidly contagious, isn't it, Dr. Anne? And we care about it because it's very good at making people unwell. What are the numbers for hospitalisation and illness?
So 1 person in 5 who gets measles will be hospitalised, will be unwell enough to need to be admitted to hospital, and 3 people in 1,000 will die. Those are the stats.
A pretty big number, 1 in 5 hospitalised. So I think people often look at the death and mortality numbers, and 3 in 1,000 is still actually quite high. But 1 in 5 is going to end up hospitalised. If you've got a room with 5 people, one of them is being hospitalised. Those are pretty big numbers.
Yeah. And obviously we did a full podcast on this way back in July last year, our very first podcast, in fact. So we won't go through all the ins and outs of measles and why it's so horrible, but it's wildly contagious. I think we said 1 person who's infected with measles is likely to infect 15 other people. Yeah. Whereas COVID or the common cold, we're looking at infecting 2 or 3 other people. So we won't labour the point. There's a whole podcast that you can listen to if you want the ins and outs of measles. But what do you need to do now is what we want to cover. Yeah.
Yeah. So it's primarily about vaccination, isn't it, Dr. Anne? And being alert.
Yeah. So anybody who's been to any of the exposure sites, and we need you to go to the Vic Department of Health website and look at where the exposure sites are. If you have been to any of the exposure sites and you are not protected, you need to have an MMR booster within 3 days of your exposure to the person, or your potential exposure to the people who have measles. Yeah.
Yeah. And for sort of rough purposes, at time of recording on a Saturday, the 1st of March, I think most of the exposure sites are in Bendigo and Melbourne's north to eastern suburbs. So sort of think Niddry, Keilor, those kinds of locations. But you've mentioned if you are not protected. How do you know if you're not protected, Dr. Anne?
Okay. We regard you as protected if you've either had the measles illness, which almost everyone born before 1966 will have, or if you know for sure that you've had 2 doses of the MMR vaccine.
Yeah. And so if you don't have 2 recorded doses, what can you do in that context?
If you haven't had 2 recorded doses and you've been to an exposure site, then you must, with some urgency, get in contact with your GP and arrange to have an MMR booster. Yeah.
And so there's lots of emails coming through at the moment about people who have had some version of, MMR testing some years ago during something for work or whatever the case is, and having shown immunity. Do they need to get rechecked down the track?
Yeah. The smart people tell us that once you're immune to measles, you're immune for the rest of your life.
Yeah.
Okay. So if you've been to an exposure site and you don't think you're fully covered, it is very important to come and get an MMR vaccine with your GP within 3 days, please. If you haven't been to an exposure site, but you think you're under vaccinated, then now is probably a really great time to check on the Australian immunisation record to see whether you've had 2 doses, but also to consider getting a vaccine now, because we don't actually know how the next few weeks are going to go, but we may have many more cases of measles as the days pass. What's the incubation period for measles, Moz?
So I think it's about 7 to 18 days, isn't it, Dr. Anne? So that's part of the reason why this is so interesting, is that we don't actually know how many people have been exposed to measles, because these cases could be anywhere from 7 to 18 days old in terms of their exposure to the original measles case. So I guess we'll have to watch this space, and that's why we're asking people to pay attention to that DHHS exposure website.
Yep. The other thing to say, of course, I've said hot foot it to your doctor and get an MMR booster if you've been in an exposure site and you don't think you're protected. However, there are two special groups that we need to talk about, and these would be people with immune compromise or people who are currently pregnant, because they are special cases, and if they are not protected against measles, then they need to have a different version of help, don't they, Moz?
Yeah, so we're talking here about the immunoglobulin, aren't we?
We are indeed.
Yeah.
And you actually have 6 days post-exposure to get that. Immunoglobulin is giving you somebody else's antibodies from pooled blood donations to give you passive immunity, which will stop you developing the illness right now. It won't protect you long term, but it'll protect you right now, which is when you need it. Yeah. So if you're immune compromised or pregnant, please also get in contact with your doctor and do so quite urgently, because immunoglobulin isn't kept. It's very precious stuff, so it's not kept at GP clinics. We have to arrange to get that to give to you.
And that's a whole schmozzle with like the Department of Health and having a chat with them and getting it transferred across. So it's a big deal. It's not a quick thing. Yeah. The other interesting group, Dr. Anne, you've talked about the pregnant people and the immunocompromised. The other group that people often ask us questions about is children, because of course MMR vaccination is really for 12 months and beyond. So what do we do if we've got a child who's under 12 months of age?
Okay, so it is safe to give the MMR vaccine from the age of 6 months, but the reason that we don't do that under non-outbreak situations is that you don't get long-lasting immunity from that dose. Our immune system doesn't seem to be mature enough to mount a long-lasting response till babies are about 12 months old. But in this situation of an outbreak, the advice usually is that you can and should get babies between the age of 6 and 11 months vaccinated.
Yeah. And I think that's probably the advice we'd be giving in our rooms, isn't it? If someone came in and they were interested in ensuring that their measles immunity was up to date and they were inquiring about their young person, we would probably not really hesitate to give them a vaccination.
We would not. They would still require to have another 2 doses at 12 and 18 months. But giving a dose now would protect your baby between the age of 6 and 12 months. And that's probably what I would be doing if I had a baby of that age at this point in time.
And it would take a miraculous series of events for us to vaccinate under 6 months, wouldn't it, Dr. Anne? Unfortunately,
it's not known to be safe, unfortunately. Babies under the age of 6 months need everybody else to be vaccinated to protect them, which kind of nicely leads me on to 2 other groups that may be under vaccinated. We do have some children whose parents at the time that MMR vaccine was offered, then for reasons which were very valid at the time, decided against it. But the situation has changed. We now have a measles outbreak in Melbourne. The risk of contracting measles has become material. It's a real and present danger. And we just ask you to have a think again about whether you might like to consider vaccinating your child. Very much a parental decision. It's not for us to tell you what to do, but the decision when there is no measles in the country and it hasn't been for a long time is very different when there is a measles outbreak.
Because as we've said, 1 in 5 hospitalised, 3 in 1,000 die. So it's a pretty significant illness. And I guess that's a great segue to talk about what we should do if we think we have it, Dr. Anne.
Indeed, although there's one other group that I'd love to talk about. But I think that you talked about it in your you released a little video yesterday, didn't you? You talked about
yesterday at time of recording. Yes, I don't know when this will go out, but yes, at some point in the not too distant past,
24 hours before we did this.
So
basically, we will just underline again that the population born between 1996 and 1992 are quite likely to be under-vaccinated. Hi, Dr. Anne in post-production, correcting myself because, of course, what I intended to say was born between 1966 and 1992. Back to the podcast. just to do with the way that the immunisation programme in Australia started, and then when we introduced the second dose, there's a fair chance that all of us in that age group, that's both of us, Moz, isn't it, in that age group, may not have
I'm
had a second
included in
dose.
1992, but thankfully I've been assessed previously. And
For
I'm
sure.
good.
But we are a fair chance that you've only had one dose of the MMR vaccine. We are the cohort most likely to not be fully vaccinated, and actually, up until now, the cohort most likely to be the people who unwittingly spread measles in Melbourne, or in Victoria. So again, kids, parents of kids who haven't had or they're not sure, please check on the AIR. But also, if you're born between 66 and 92, have a little check, because you might also be under vaccinated. And we would love people to come in an orderly fashion, electively, not in a panic situation, and just get themselves immunised now, before we see where this is heading, before it all
So what you're saying is you want
on
people
us.
to get ahead of it rather than wait until there's
Yeah.
3,000 cases in the Diamond Creek, Eltham, and Yarra Trail regions.
Absolutely.
Very good, excellent. Yep.
Okay, so moving on to, what do you do if you think you've got measles?
So measles looks a lot like a lot of other viral illnesses. You get a fever, you get a runny nose, but where where measles is quite different is you get that classic rash. And maybe we'll see if we can again put photos up from the DHHS's website for that rash for people who are watching on Spotify or YouTube. But basically, please talk to your doctor, but not in their building. So please don't roll up to a bloody emergency department. Don't roll up to a general practice. Make a phone call and probably get yourself seen in either the infectious control room of the emergency department or in the car park of your general practitioner's clinic. Again, if you are a young pregnant GP, you do not want to see a patient walk into your door and say, by the way, I'm pretty sure I've got measles. That's not a very courteous thing to do.
That's not how we like to handle it, no. Measles hangs around in the air for about 2 hours after an infected person's been there. So if you go into your GP clinic or the emergency department with your measles, then all the spaces that you have been in have to be vacated of people and allowed to air for a couple of hours, which is not terribly practical for the rest of the world, So we will absolutely help you out. We absolutely want to hear if you think you have measles, but please phone, give us a heads up. We will come to see you in the car park. We will have masks on, but we still like you, but we don't want your cooties.
So this is really great for car park consults, telehealth consults, virtual ED, that kind of thing. This is a great conversation because all of those conversations around the immunoglobulin, the vaccination, all of that can happen over the phone or in the car park. Absolutely.
Yeah. Okay, summarising this hopefully in less than 60 seconds. There are measles cases in Melbourne. You need to check the exposure sites, and if you have been at any of them and you're not fully vaccinated or had the illness before, you need to do something. You either need a booster, or if you are pregnant or immune compromised, you actually need to see your doctor and organise immunoglobulin. Everyone else, we would love you to think about whether you and your kids are fully vaccinated. And if you're not, to do something about that in an unhurried fashion before shit hits the fan. Yeah. We hope the shit doesn't hit the fan, but there's a distinct possibility.
Yeah, that's right.
Yeah. And final thing to say, I guess, is that those people born before 1966, the presumption is that you are already immune, that everyone who's older than that pretty much had it as a child. So that's the advice that we are given. I guess if you were born before 1966 and you are keen to either check your serology or indeed to just have a booster, just in case, maybe you've got small grandchildren, we would not stand in your way for either of those things.
No.
You would have to pay for your MMR vaccine. You're not entitled to a free one, but it would not be a bad move, I would think. What do you think, Dr. Moz?
Right. No, I agree with that. I wouldn't get in the way of a serology test for really anyone, to be honest. So, yeah.
Okay. Any more things to
Excellent.
say?
No, I think we've covered it. Stay home, keep your cuties at home, talk to your doctor over the phone, check if you're vaccinated, and look out for each other.
Yeah. So thanks for your attention today. The bit that we forgot to say at the beginning, Dr. Moz, that this does not replace advice from your doctor, although I think we have been fairly directed with advice, but this is a special situation and a special edition of the Medical Minute podcast.
I would argue we're still not giving individual personalised advice. We're sharing the advice of the DHHS and what we would do in generalities. Yep.
Definitely. Okay, thank you for your help and input, Dr. Moz.
See you next time, Dr. Anne.
Take care. Bye.